Speaker, the gentlemen from the other side of the aisle have already voted over 50 times to roll back the Affordable Care Act. This is one more attempt. More than 150 million Americans get their health coverage through their jobs or through a family member's job. And the Affordable Care Act, when we passed it, at that time, 96% of all businesses with over 50 employees provided health insurance for their full-time employees. Now, so that we wouldn't dismantle the present system, that we would build on it, we established a mandate for those employers, those businesses with over 50 employees, would be mandated to provide insurance for their full-time employees. 96% were already doing it without a mandate. Those under 50 employees weren't subject to the mandate. Now, this bill would change the ACA's definition of full-time employee for somebody who works 30 hours a week to 40 hours a week. Now, that puts a lot of Americans at risk of having the hours cut to just under the 40-hour threshold, so that a few employers, just a few, 96% were already doing it, can escape their responsibility of providing the insurance. Now, they're less likely to suffer a job loss today because most people work a 40-hour week. Cutting below 30 is very unlikely because people would start quitting. 96% were already being provided their insurance. But now, if you are working from 9 to 5 with an hour off for lunch, suddenly you're no longer a full-time employee. That's only 35 hours. Or if the employer sends everybody home at 4 o'clock on Fridays, that's 39 hours. You're no longer a full-time employee. And as a result, many people, those currently working between 30 and 40, and those who will have their hours cut, will suddenly be part-time employees not entitled to employer-provided health insurance. Now, according to the Congressional Budget Office, that's about 1 million people who will lose their employer-based health coverage. So, Mr. Speaker, this is just another attack on the health security of American families. It's an attack that families do not want, but it will help. It will help that handful of businesses that just want to deny hard-working employees their health insurance. And we've heard all these job killing. I want to put one thing on the record. We've had more consecutive months of 200,000 plus job growth than any time in recent history. So the job killing aspect of it can't be doing too bad. A lot more than there were under the previous administration. Now, Mr. Speaker, we ought to be building on the ACA, not diminishing it. We ought to be working to strengthen it, including fully expanding Medicaid to all 50 states. We can do better. This hurts families, might help a few businesses that want to deny hardworking Americans their health coverage. It's been mandated, although 96% of businesses already were doing it.
The gentleman yields back.